Pancreatic enzymes help with digestion and are inactive when they are inside the pancreas. They activate in the small intestine. If you are an alcoholic, scar tissue occurs in pancreas. It creates an occlusion in pancreas and prevents enzymes coming out. Gallstones can occlude the enzymes from coming out too. The enzymes then activate inside the pancreas as it gets tired to wait to activate. This causes pancreatitis. Pancreas eats itself. Ileostomy, surgical procedure that creates an opening stoma in the abdominal wall that originated from the intestinal mucosa of the ileum. In the beginning, low-fiber diet. To prevent obstruction of the narrow lumen of the small intestine, foods to be avoided include stringy texture, celery, broccoli, asparagus stalks, high fiber, bread, brown rice, oatmeal, seeds or pits, strawberries, raspberries, olives, edible peels, apple slices, raw cucumber, dried fruits, nuts, peanuts, almonds, cashews, foods to eat, fruits and veggies that are pitted, peel cooked, low-fiber carbs, white rice, refined grains, pastas, cooked cereals. Cholecystectomy. After the procedure, place in Sims position. It helps prevent respiratory complications. It helps with the movement of CO2 used during surgery to fill the abdominal cavity. CO2 can irritate the phrenic nerve and diaphragm, causing breathing difficulty. Diet, related to weight reduction and maintaining a low-fat diet. Pyelonephritis. UTIs that occur in the kidneys, inflammation of the kidney parenchyma in the bladder, cystitis, and or urethroarthritis. It causes flank pain that is experienced in the back of the costovertebral angle and may spread toward the umbilicus. Cystitis alone does not cause NV or chills. Presence of these, fever, and signs and symptoms of a low UTI, dysuria, urgency, and frequency indicate pyelo. Pain in pyelo is dull, constant, and maximal at the costovertebral angle area. Cystitis, UTI in bladder, suprapubic pain, and spasms, dull and continuous, distended bladder. Constant pain increased by pressure over the bladder. Distension is found through palpation. Firmness, pain, urgency and percussion, dullness, over suprapubic area. Renal colic pain, excruciating, sharp, stabbing. Unable to find a comfortable position, tossing in bed. Pain radiates down to the groin area from flank as stone travels down the aorta. Sepsis. SAS, systemic inflammatory response syndrome with an infection suspected or proven. Complication of pneumonia can be diagnosed with two of these for criteria: temp 28C or 36C. HR greater than 90 BPM, R 20 per minute, WC 12,003. For 1,003 or 10% immature band forms, additional second per second, sp. 90 mm Hg. Altered mental status, hypoglycemia greater than 140 mg RDL. Early therapy, aggressive fluid. Resuscitation and early administration of antibiotics can occur as a complication of pneumonia. Who don't respond to AB care? It is caused by the entry of bacteria from the alveoli into the bloodstream. It can progress to septic shock and or multi-system organ dysfunction syndrome. 2 limit progression, assess oxygenation pulse oximeter, ABGs. Airway patency, breathing rest pattern and rate. Circulation vital signs, tissue perfusion lock, cap refill. Skin temp and color, bowel sounds and urine output. Paralytic ileus occurs in the presence of sepsis and hypoxia. As blood is shunted away from the G to the vital organs, prolonged cap refill greater than 30 for seconds in. An adult indicates inadequate blood flow to peripheral tissues, serum glucose greater than 140. Gluconeogenesis occurs in response to the physiologic stress of infection. Insulin resistance is associated with anaerobic metabolism. Kidney biopsy. Bleeding is a major complication following the procedure. Pre-procedure, client must give consent, and D. See all anticoagulants, heparin, warfarin. rivaroxaban and antiplatelet agents aspirin, clopidogrel. NSAIDs for at least 1 week, post-procedure, Mon/V per second, at least Q15 minutes for the first hour as. Tachycardia, tachypnea, and hypotension can indicate blood loss. Assess puncture site dressing for bleeding. Bun and creatinine levels would not change much within 30 to 60 minutes. These are usually measured once every 24 hours and rarely every 12 hours. Inserting an indwelling urinary catheter is not necessary to perform a kidney biopsy. Place prone during procedure to facilitate access to kidney. Place on affected side after. Procedure to provide pressure and help prevent bleeding. Bed rest for 24 hours. Statins, prior to starting therapy with statin drugs. The client's liver function test should be assessed. The drug is metabolized by the hepatic enzyme system and could cause drug-induced hepatitis and increase liver enzymes. Drug can also cause muscle aches and rarely severe muscle injury, rhabdomyolysis. Educate client to report the development of muscle pain. While on therapy, assessing muscle strength or dietary intake prior to therapy is not necessary, may slightly increase serum digoxin levels, but is not essential to determine this before therapy is started. Acute urinary retention. Treated with rapid, complete bladder decompression instead of intermittent urine drainage, this can lead to hematuria, hypotension, and diuresis. Maintaining perfusion and adequate blood pressure is the priority concern. Bradycardia is also a complication. Chronic kidney disease, decreased glomerular yellow filtration rate, resulting in fluid, K, and phosphorus retention. Fluid retention is initially treated with no restriction and diuretic therapy. Dietary adjustments should also be made to reduce serum K and phos levels. Dairy products, milk, yogurt, and certain fruits, banana, oranges, coconuts, watermelons, and avocados contain high K. Allowable foods: apples, pears, grapes, pineapple, blackberries, blueberries, plum. Lasix furosemide, potassium-depleting loop diuretic. Hypokalemia can lead to heart palpitations and/or dysrhythmias, bladder cancer. Telltale symptom, painless hematuria. Primary cause is cigarette smoking or other tobacco use. Occupation carcinogen exposure is the second most common factor. Printing, ironing, and most aluminum processing, industrial painting, metalwork, machining, and mining. Clients are exposed to carcinogens through direct skin contact and inhalation, aerosols, and vapors. Other risk factors: high-fat diet and artificial sweeteners. Influenza has an incubation period of 14 days, with peak transmission starting at about 1 day before symptoms appear and lasting up to 57 days. After illness stage begins, transferred through inhaling airborne droplets, sneezing, coughing, speaking, and direct contact. Wear a mask if contact with infected person is unavoidable. Those with influenza cannot transmit the virus during the incubation period and illness stage of the infection. Avoid close contact with others during illness stage. Those with impaired immune system.